Hormone replacement therapy can consist of a number of different components. It can consist of estrogen in its various forms. Progesterone can be utilized, testosterone, and also the precursors to those hormones, which are DHEA and pregnenolone. Depending on a patient's certain symptomatology and physiologic biological needs, you can incorporate supplementation with these hormones to help the body function more efficiently and more optimally. There are many different ways to utilize hormone replacement therapy. I'm very much a proponent for bioidentical hormones. I think it's important to be able to utilize the hormones in a way that they're being compounded in a specific ratio and combination and dose that's specific to each patient, who's been evaluated by a clinician, who's had some testing to make sure they're able to tolerate and metabolize the hormones efficiently and not cause an excess of the hormones in the system. There are lots of different buzzwords and popular approaches that are used now in hormone replacement therapy. And I think it's interesting to be on both sides of the pendulum. I say often that I stand here and I remember when the pendulum swang in the way where we didn't give anybody bioidentical hormones during Women's Health Initiative years. And now the pendulum's really swung the other way in that, you know, it is good and safe and accepted for everybody. But I think it's also gotten to become a bit of a fad in a lot of ways. And there are definitely some things that are being done out there that are not so safe, and people aren't being evaluated comprehensively and in a holistic way, and things are kind of being done within a cookie cutter regimen, and that's not always best for everybody. So I think it's really important that in pursuing hormone replacement therapy that you seek out a provider who has been doing it for a while, can explain it to you in a way that you understand and resonates with you, is willing to take you through the process of doing a thorough workup and evaluation, talking you through your needs and expectations, and coming up with a plan and a protocol and a regimen tailored to you and your specific needs and not necessarily standardized dosing.